If you're over 60 and you masturbate regularly, what's really happening to your prostate might shock you. Most men think it's just a harmless release, or maybe even a secret health booster. But science paints a far more complicated picture. Your prostate doesn't just sit there unaffected. It reacts, adapts, and in some cases, changes in ways that could either protect your health or quietly put you at risk. I'm Dr. Mei Anderson, a urologist and men's health specialist with over 25 years of experience helping men navigate these exact issues. And today on Vital Health Seniors, I'm going to reveal the truth about daily masturbation after 60 and what it does to your prostate. Some of what you hear may surprise you, some may comfort you, but one thing is certain. By the end, you'll never look at this private habit the same way again. Now, let me deliver immediate value right up front so you understand why this matters. Researchers from Harvard tracked men in their 50s, 60s, and 70s and found that those who ejaculated more frequently, through sex or masturbation, actually had a lower risk of developing prostate cancer. Sounds good, right? But here's the twist. When that same data was broken down by age, the protective effect wasn't the same for everyone. In men past 60, the benefits plateaued, and in some cases, daily masturbation correlated with irritation, swelling, or changes in the prostate that could mimic disease. That's the kind of detail most men never hear about. So why does this happen? Think of your prostate like a valve system. When you're younger, that valve is strong, flexible, and designed to handle frequent activity. But as you age, inflammation, reduced testosterone, and slower healing all change the way your prostate responds. For some men, daily masturbation helps clear the ducts, preventing congestion. For others, that constant demand creates microscopic trauma, fueling low-grade inflammation that, over time, can set the stage for bigger problems. And here's where you need to stop and ask yourself, do you really know which category you fall into? Because if you don't, blindly assuming more is always better could be a dangerous gamble. This is exactly why so many men over 60 suffer silently with enlarged prostates, weak flow, and frustrating midnight bathroom trips, without realizing that their daily habits might be part of the cause. And honestly, if you're hearing this now and haven't subscribed to Vital Health Seniors, you need to ask yourself why. Men who ignore this kind of information are the ones who usually end up in the ER with a catheter, begging for answers too late. If you're smarter than that, and I know you are, hit subscribe right now. Don't wait until you're commenting 6 months from now saying, I wish I listened. Now let's dig deeper. One of the biggest concerns I see in men who masturbate daily after 60 is prostatic congestion. Imagine a sponge that keeps soaking up fluid but never fully drains. That's your prostate when the ducts can't completely clear with each ejaculation. Over time, this creates a swollen, tender gland. You might notice dull pain, pressure in your pelvis, or a weaker stream. Some men even describe it as a heaviness after climax, rather than relief. And yet, here's the paradox. Completely avoiding masturbation isn't the answer either. Too little activity can actually increase congestion, leading to inflammation, calcifications, and higher PSA readings at your doctor's office. That's why men who swing between extremes, either daily release or months of abstinence, often end up with the worst outcomes. The truth, as always, lies in balance. But let me be clear, balance is not one size fits all. For one 62-year-old patient of mine, cutting back from 7 times a week to 3 relieved years of unexplained pelvic pain. For another, maintaining 4 to 5 times a week actually reduced his nighttime urgency and improved his flow. The difference? Genetics, diet, hormonal profile, and prostate health status. Which is why you cannot blindly copy what your buddy does. You need to understand your own body's feedback. And here's the part that really makes men lean in. Prostate changes from daily masturbation don't just affect your gland, they affect your performance. Inflammation narrows blood vessels, weakens erections, and increases recovery time. If you've noticed that what used to take you minutes now takes much longer, or worse, that climax feels empty, you might already be experiencing these changes. This is where the fear should hit. Because if you don't take control now, the downward spiral accelerates. You'll not only lose function but confidence. And confidence, for men over 60, is just as vital as testosterone. That's why, again, if you haven't subscribed yet, you're literally setting yourself up to fail silently. I give away decades of insider, urologist-level knowledge for free. If you can't hit subscribe, then be honest. Drop into the comments and tell me why you'd rather gamble with your prostate than click one button. I guarantee other men will call you out. Now let's pivot into what you can do to protect yourself if you enjoy daily release. The first key is hydration. Semen is fluid-rich, and your prostate depends on a well-hydrated system to flush out irritants. If you're masturbating daily but sipping only 2 glasses of water, you're asking for trouble. Aim for steady hydration throughout the day. Your flow, your prostate, and even your erections will thank you. Second, diet. Prostates thrive on anti-inflammatory foods. Tomatoes for lycopene, green tea for antioxidants, pumpkin seeds for zinc. But here's the kicker. If you're pounding red meat, processed foods, and alcohol while masturbating daily, you're creating the perfect storm for prostate irritation. I've seen men who thought they had prostate cancer only to discover it was diet-driven inflammation compounded by overuse. Third, exercise. Pelvic floor strength directly impacts prostate drainage. Gentle walking, squats, or even pelvic stretches improve circulation in ways most men overlook. And circulation is everything when it comes to keeping your prostate and your erections healthy after 60. And listen, if you're finding this helpful, don't just keep it to yourself. Hit like and share this video with a friend. Too many men suffer in silence because they're too embarrassed to talk about these issues. You could literally save someone from years of discomfort just by clicking share. Before we wrap up, let me address the elephant in the room. Men often ask me, "So Dr. Anderson, is it safe or dangerous to masturbate daily after 60? And my answer is, it depends on how your prostate responds. If you feel relief, better flow, and no pelvic pain, you may be in the clear. But if you're experiencing pain, swelling, weaker erections, or constant urgency, your prostate may be crying out for rest. Ignoring those signs is like ignoring chest pain and hoping it's just indigestion. Here's the bottom line. Daily masturbation after 60 is not inherently good or bad. It's a test of how well your prostate can still adapt. For some, it's protective. For others, it accelerates decline. But the only way you'll know is by paying attention, adjusting your habits, and staying informed. And that's why I created Vital Health Seniors. Because you're not going to hear this from most doctors in a rushed 5-minute appointment. You'll hear you're fine or come back in 6 months. Meanwhile, your prostate could be undergoing changes that affect your health for decades. So if you're still watching and haven't subscribed, let me be blunt. You're doing yourself a disservice. You've already invested 10 minutes learning the truth most men will never hear. Subscribe now and commit to protecting your health. And when you do, drop a comment telling me your age and your experience with prostate health. I read everyone, and your story could help another man feel less alone. This is Dr. Mei Anderson, and remember, your prostate may be small, but it has the power to control your freedom, your vitality, and your confidence. Treat it wisely. I'll see you in the next video.